Welcome to our season on dermatology. This is lecture 1, which is word parts. Now a little bit of an introduction. This is the first episode for dermatology focusing on word parts in the organ system. The previous systems provided the foundation for the rest of the semester. So don't worry if you still need to work on the previous material, you can still do so. But moving forward, we'll now move into the skin chapter. For the rest of the semester, the first lecture in each chapter will always cover word parts. This approach helps you focus on the key elements needed for each chapter. So covering prefixes and suffixes, common prefixes and suffixes such as ectomy will appear repeatedly throughout the course. Mastering these will give you a strong foundation as they are used in every chapter. If you are still working on them, that's perfectly fine. Continue to review them. Combining forms will follow next, and that's primary focus will be on combining forms unique to the organ system. Some combining forms may be unusual or have multiple meanings. Occasionally we'll encounter new suffixes, but the main emphasis will be on word parts. Okay, let's go ahead and get started with our first combining form, and that would be adeno. The combining form adeno means gland. An example in dermatology like sweat glands or sebaceous glands. Future topics, we're going to revisit this combining form in the endocrine system, which is the very last system in this course. The endocrine system involves many glands, so understanding adeno is very crucial. The next combining form is adipo and lipo. Now both of these mean fat, right? If you encounter a mental block with using these combining forms, try relating them to everyday terms. So for example, liposuction, that can help you remember that lipo means fat. I've said this before, but I'm going to encourage you, if you come across a combining form that you just developed a little mental block about and you just have trouble remembering it, see if you can find an everyday term. If you're not sure, you can remember it. So for example, lipo was the example for fat. Most people know what liposuction is, so you can lean on liposuction to help you remember what lipo is in this case. Okay, the next combining forms are dermo, derma, and dermato, right? So dermo means skin, derma means skin, and dermato is another combining form that means skin. The context in dermatology, how this is applied, these combining forms are used extensively in dermatology, which focuses on the study and treatment of skin conditions. The next one is diaphoretic, right? That just means sweaty, right? Or diaphoro is a combining form, but the example for the word is diaphoretic, and it just means sweaty. So if you go to the gym, you run a few miles on a treadmill, and it's hot, you'll likely be quite sweaty. So in medical terms, you would be described as diaphoretic. This combining form is hydro, H-I-D-R-O, right? And hydro means sweat. It's similar to another combining form, hydro, which sounds the same but with a Y, H-Y-D-R-O, and that means water. If it's with an I, that means sweat. So just remember the difference between hydro, H-Y-D-R-O for water, and hydro, H-I-D-R-O for sweat. A little more about this in context. It's used in medical terms related to sweat and sweating, or profuse sweating. Next up is kerato, right? Kerato can refer to keratin, that protein that's found in the skin, the nails, and the hair. It can also refer to the cornea, the transparent front part of the eye. So this can mean two things. But since we're in dermatology, section will be focusing on the keratin that's related to protein found in skin, nails, and hair. So to determine that correct meaning, just consider the context in which the term is used. Medical terms will be part of sentences or paragraphs providing necessary clues, and you can look that up if you're just jumping into something and you don't know which kerato they're referring to. Okay, the next two are onycho and unguo. These just mean nail. They both mean nail. So onycho is a more commonly used term, O-N-Y-C-H /O. but it's important to know both. Okay, the next two words are prurito and soro, and both of these mean itching. So when you get poison ivy, you experience a very itchy rash. It's described as pruritic, which is the more commonly used term. The other term is soro, and that's commonly seen in terms like psoriasis, which is a condition characterized by itchy, scaly skin. Now the pronunciation tip here is whenever you see the letter P and it precedes an S, like in sorrow, well, it's silent, so it's sorrow. But with prurito, you try to pronounce the PR, prurito. It's also silent in other things like pneumonia, where you have a P and it precedes an N. The next combining form is squamo. Right? Squamo means scaly or scale-like. There's a little historical context of this. The origin of the combining form comes from the Latin and Greek descriptors used by early scientists to describe what they observed. So squamo was used to describe scale-like structures. An example would be, we'll discuss squamous cells, which are like flat scale-like structures in appearance. And you can see that here on the image. Next one on the list is allo, A-L-L/O, and that just means other or strange or different. And we use this when we refer to skin grafts, right? So you're placing a new piece of skin over one that's been injured. So skin grafts, we'll call that an allograft, and that just means that you take a piece of skin from someone else, and which is strange, it's other, it's different, and you use it to repair an area on a patient. Okay, and the next one is auto, A-U-T/O, and this just means self. Now this we can use this as well with grafting, with skin grafting. So in this case, unlike an allograft, which you're getting a piece of skin from someone else, an autograft, graft with a T, involves taking healthy skin from another part of the individual's body, another part of the patient's body, and then they graft it to the injured area. Blepharo. Blepharo means eyelid. Right? So this is a combining form that's used in medical terms related to the eyelid. Right? And you can see there in the picture we have an example of blepharitis, where you see one side of the eye is inflamed and the other side is not. The next term is ictero, and this just means jaundice. So it's a condition where the skin and the eyes become yellowed. We're going to discuss skin colors in more detail in a few slides up. You might be familiar with this combining form. It's used often in movies, necro. Right? That just means dead or death. It's the combining form that's often used in medical terms related to dead tissue or dead cells. The next one is retido, and that just means wrinkle or wrinkling. Right? So if someone gets a facelift, what they're known to get is a Rytidectomy, kind of hard word to say, and that just means the surgical removal of wrinkles. The next combining form is xeno, and xeno just means foreign. You might know this from the, the Xenomorph, the Alien movies. So it just means foreign, it means alien. So an example of this in a medical term would be a xenograft, and xenograft just involves a skin graft from another species. And you can see there in the picture where we have a donor sample from a pig or pig cells. Well, there are different types of xenotransplantations in the picture, but the very top one is one that's related to this chapter for dermatology, would be for skin. So the next term is xero, but I'm going to relate it back to xeno only because they look and almost sound the same, so make sure that we distinguish between the two, right? Xeno, we said, means foreign. If you think of the word xenophobia, which is being used a lot recently, it just means fear of foreigners. Was xero, X-E-R-O, Xero, it just refers to dryness. So think about your landscaping. If you live in an area where you have water restrictions, then they encourage people to xeriscape, meaning remove things that need water and just have like a rock garden instead of plants. So that's xeriscaping, creating landscapes that don't require a lot of water. There is a mnemonic, right? Xeno relates to something foreign or different, like in xenophobia. So, well, that's not really a mnemonic. Zero relates to dryness, such as xeriscaping. That's just using words that are common and familiar. So, a term used to describe water conservation, landscaping is xero. And think of that when you have xeros in the skin, it's going to be dry. Hopefully that helped. Okay, so we're going to talk about some combining forms for colors. And the first one, you might know some of these from your printer colors. Right? So cyan, cyano, which refers to blue, it's often seen in medical terms related to blue discoloration, like in cyanosis. And I have pictures around this slide, and it's up to you to figure out which slide is referring to which color. Melano, right? Melano just means black. And it's a term that is used to describe the pigmentation for the skin, melanin, that's responsible for the skin color. Leuco, Leuk/O, just refers to white. That's commonly used in hematology for terms like leukocytes or white blood cells. Erythro, right? That means red, and that applies to red skin, especially when it's irritated. And it's also used in terms like erythrocytes. Remember, cytes means cells, so red cells. This refers to red blood cells. Xantho is another word that refers to yellow. Right? We said jaundice actually, pertains to yellow. And so xantho is as well related to like a yellow discoloration. You can have a xanthoma. Yeah, that's it for the colors. Let's cover some abbreviations and acronyms. And the first one's going to be BSA, or body surface area, used in discussions of, say, dosing medications and assessing burns. Good fun fact for BSA, it also stands for Boy Scouts of America. Are they still a thing? I'm not sure. CNS, culture and sensitivity. It's a procedure where a sample is cultured to identify an infection and determine its sensitivity to antibiotics. Those of you who will be taking microbiology will be, learning how to do those assays. CD, it might mean something different to somebody who was alive in the 80s, but for medical, it means contact dermatitis. Right? So it's an inflammation of the skin caused by contact with an allergen or some irritant, like poison ivy. The next one is EGFR, which stands for epidermal growth factor receptor. And these are receptors on cells that cause epidermal cells and tissues to grow. The next one is a protein. You might be familiar with this if it was being talked about in the pandemic, the IgE, immunoglobulin E. And it's a type of antibody involved in allergic reactions in certain types of dermatitis. And the last acronym is IT, right? That could also be an abbreviation. Notice an acronym. Intradermal test. So intradermal test. And it's a test where a small amount of substance is injected just under the skin. So think of things like the TB test that you normally take. If any of you have had allergy testing where they give you just a little bit of the allergen under the skin, that would be the same thing. Okay. All right, great job. You've successfully made it to the first part, which was word parts. Go ahead and take a well-deserved break. The next part is going to be on anatomy, and we'll see you soon. Hold on, I want to do this, see if no, it doesn't do it. Okay, so this is supposed to be a 360 image, and it's supposed to swerve and move around, but it's not. All right, welcome to the next section for dermatology, and we're going to cover anatomy here. This is our first organ system, and so I'm going to give you an overview of what to expect in terms of anatomy in this class. So why do you study anatomy and medical terminology? That's a good question. Understanding anatomy provides context, making it easier to remember terms and combining forms. So instead of memorizing terms in isolation, understanding their meaning helps in long-term retention. So we use this approach to anatomy. This is not an anatomy and physiology class. I've said that before. It's just a basic overview to help you understand medical terms. If you've taken anatomy and physiology before, you'll find this easier and more familiar. If you haven't taken anatomy and physiology or A&P, this is going to prepare you for future studies without being overwhelmed when you do take the class. So the goal when we do these little sections on anatomy, they're to provide context and make the medical terms meaningful and easier to recall instead of just being black and white letters on the screen. So think of it as like a low-calorie anatomy course, low stress, and easy to digest. These little sections. We're going to have them in every system that we discuss from here on out. So I just don't want you to stress when you see the word anatomy here. This section should be fun, should be useful as we go through the organ system. All right, let's go ahead and get into functions of the skin. And the first function is physical protection, right? That makes sense. Intact skin provides a barrier against germs, bacteria, viruses, and UV rays. So example, your hands are protected from germs on doorknobs, right? Everything you touch. The next thing is thermal regulation. So the skin helps regulate body temperature with the help of the nervous system. An example here would be in winter. If you have a bald head, or like myself, going bald, you may feel colder due to less heat retention. I'm fighting it, don't worry. I'm gonna fight it. Not the heat retention, the hair loss, right? Modern technology. So anyway, what ends up happening is that you put a hat on, it helps retain the heat from being released. Sweat glands also help cool off the body in hot conditions. So again, when you're in summer, especially in Texas, you're exercising or doing something, you're sweating, that whole sweat is a part of a cycle to help cool you off. Right? What else? Oh, sensory inputs, the next one. Just looking at the slides. So in your skin, you have nerve endings, and the nerve endings help sense the world around you. So think about the senses that you have. You can hear, you can smell, you can touch, you can sense heat, sense pressure. So you have those pressure sensing, heat sensing type of receptors and pain receptors in your skin as well. So imagine you touch a hot cup of chocolate. We'll say chocolate. I'm not a coffee drinker. And you touch it with your fingertips, really lightly tap it, you feel the heat right away. It's like, oh, let it cool down. Okay. The last function is cholecalciferol. This refers to vitamin D3 production, right? So the skin synthesizes vitamin D3, which is cholecalciferol. It does this in response to sunlight. So you need sunlight. Don't stay indoors all the time. If you work indoors, take a break outside. And what this does is aids in calcium maintenance throughout the body. So exposure to sunlight helps your body produce vitamin D3. Going into skin layers, let's go ahead and look at the epidermis. And you see there we have 3 different types of cells, keratin, melanocytes, and Langerhans cells. Let's go through each one of those, right? So first, the epidermis. Right? The outermost layer of the skin, epi just means above, so this is the layer that you see when you look in the mirror. Now the parts that make it up, keratin, that's just a protein that's found in the epidermis, and it makes up, there are cells called keratinocytes. Melanocytes, these are cells that produce skin pigmentation. Everyone has roughly the same amount of melanocytes, but the amount of pigmentation produced varies, and that leads to all the different skin tones. The next one is the Langerhans cells, and these provide some immunity, and they act as the first layer of protection against pathogens. So those are the different types of cells within the epidermis. Just a little bit more, that the epidermis is a thin layer. New cells are produced at the bottom of the epidermis. They move to the top as they mature, and they eventually become dead skin cells. And those are the cells you actually see, the dead skin cells. Everything you're looking at yourself is dead, unless you exfoliate, right? So Exfoliation, that happens naturally, and you can actually exfoliate as well to help the natural exfoliation. But it's a natural process of shedding dead skin cells. Again, you can aid this mechanically by buying one of those exfoliating washcloth sponges. All right, and an interesting fact, and a good reason for you to get out of your house more often, household dust, right? The most household dust is made up of dead skin cells. So all the dust that you are sweeping if you clean regularly on your blinds, on your ceiling fans, most of the dust is composed of dead skin cells. So if you're breathing in dust in your house, you're breathing in dead skin cells. So a good reason to clean more often, and a good reason to get out of the house and breathe some fresh air. Okay, let's talk a little bit about the dermis. Again, this is not a full anatomy course. Let's just give you a little overview of the dermis. You see the things we're going to talk about here: collagen, elastin, the blood vessels, nerve, hair follicles, and glands. But what about the dermis? It's thick, right, compared to the epidermis. It's a functional layer of the skin, and this is where most of the skin's key functions occur. Some of the components, like I mentioned, are collagen, and collagen just provides firmness to the skin. An example would be as collagen production slows with age, skin starts beginning to droop. So that's something that you'll notice if you have collagen deficiency. Elastin just provides elasticity to the skin. It allows the skin to stretch and accommodate changes such as during pregnancy. And so that it can come back to normal, right? If it's not taken care of well, and it's beyond the elasticity of the skin's capability, then you end up getting tears. The next thing are the blood vessels, which are the arteries and veins, right? These are part of the vascular system, and it provides blood flow to the skin. We mentioned before, we have sensory, but we have nerve endings that allow for sensory input in response to environmental stimuli. We have hair follicles on our outer skin. Sometimes I want to say a joke, and I stop myself. Okay. Hair follicles, yeah. So the skin produces hair, and that can actually help with temperature regulation. It also helps with sensory input as well. We have sebaceous glands, right, and sweat glands. So sebaceous glands, they produce what's called sebum. That's an oily substance that lubricates the skin and hair. And sweat glands, well, we know what those do. They produce sweat, and that just helps the body in cooling and temperature regulation. The next layer is the subcutaneous layer, and we're going to talk about the fatty layer area there. And it also says it's the area of connection. So this is the area below the fatty layer that connects to the underlying tissue. But subcutaneous, right? That means sub means below, and cutaneo means skin. So that's where we get subcutaneous, and that just means it just pertains to below the skin. It primarily serves as an anchoring system for the skin to the body, and it's made up of the fatty layer, and the fatty layer contains just fat underneath your skin. And the connection part, that's where it anchors the skin to the body, and it provides stability. So your skin doesn't just like slag and droop. So again, the structure of skin, we had the epidermis, the dermis, and we had this subcutaneous layer. Just a little bit of a summary on all this. Epidermis, the outermost layer of the skin that you see. You can look at the picture there as I described this. It has an up and down, structure like hills and valleys, and it has a pattern that helps it connect with the dermis. It contains keratin, melanocytes, and Langerhans cells. Okay. The next layer was the dermis, and that's that functional layer of skin with the collagen, elastin, arteries, veins, nerve endings, hair follicles, and the glands, sebaceous and sweat glands. And then we talked about the subcutaneous layer. That's the layer that contains the fatty tissue, and it serves as that anchoring system. And hopefully this picture will help act as a visual aid so you can visualize all of this. All right, so we've got some pictures here to give you a little more detail on the glands, and what we see here are the sebaceous and sweat glands. So the sebaceous glands, right, produce sebum, and it produces sebum, which is that oily substance that it conditions and maintains the suppleness and flexibility of the skin. So it's necessary. I would say don't try to wash it off. Some people do produce too much, and some people don't produce enough. Sebum conditions skin like oil conditions a baseball glove or like a saddle, right? Or if you're in a motorcycle, like your motorcycle seat. Sweat glands. Oh, and yeah, sweat glands. So we have two types of sweat glands listed here, eccrine and apocrine. Eccrine glands, they produce sweat, and that helps cool off the body during exercise or in hot environments. So eccrine glands they just make you sweat when you work out, or if you're standing in line at SeaWorld here in the middle of July in San Antonio, Texas. The apocrine glands, they're located in the groin, the armpits, and these glands don't become functional until puberty, right? And these are the ones that produce odor, if you know teenagers. And so the apocrine glands produce odor, but they don't really help in cooling off. What are they used for? To warn others that teenagers are coming around the corner. All right. This next slide, we're going to talk about hair and nails. So hair, the three parts are the keratin follicles and what's called the piloerection muscle. So let's go to start with keratin. All right, the hair is made up of keratin, and that's just a protein that provides that strength and structure. You might have seen shampoo commercials mention that. The follicles, the root or base of the hair, that's where hair growth begins. And then piloerection, that's the process. Piloerection is the process where hair stands up due to some external stimuli or emotional response, or you get the chills or you get scared. Right? That's when you get those chills, the hair in the back of your neck stands up. You can see that on the picture there. Talking about the nails also have keratin, and nails are made up of keratin. It provides strength and protection. The nail bed, where the nail lies on top of, that's the area the nail bed is where the nail is attached to the skin. So if the nail falls off, the nail bed typically becomes affected. The nail root, that's the base of the nail, and so growth is located underneath the skin, if you can see that in the image. And then if you're looking at the nail again, let's just say the superior view, you have that lanula, and that's that white half moon shape area at the base of the nail, and it resembles a crescent moon. People say it resembles a crescent moon, and I'm repeating that, but it never looks like a crescent moon to me. Okay. All right, y'all did a great job. You successfully completed this part, which is anatomy. You see, it didn't have to be hard at all. So we're going to continue and keep things straightforward and easy to understand. Throughout the rest of the semester, we're going to be doing anatomy of each one of the systems. What else? What comes next after anatomy? After every anatomy section, there's going to be a health and wellness section, and that's what we're going to cover next. And I will see you soon. All right, and welcome to the next section for dermatology, which is health and wellness of the skin. We're going to focus on skin health, assessing skin health. What does healthy skin look like? We're going to look at things like the color, the texture, moisture, elasticity, hallmark characteristics of healthy skin like brightness. We won't get into the detail of it, but we'll see some pictures that look at lesions, pore sizes, things like that. What else? Yeah, we're going to go ahead and do that. So let's get started. Okay, so when you're assessing healthy skin, these are some of the things you want to look for. And the first one, what the doctor will look for, or the dermatologist. All right, so turgor, and that's just the elasticity of the skin that's related to fluid balance. So to do this, they pinch the skin on the back of your hand, and if it returns quickly to its normal shape, you have good skin turgor. If it stays tented, like a tent, you might be dehydrated. If you ever have a bad headache and it just might be because you're not hydrated enough, just do the Turgor test. And if you see a difference in the response of the skin when you pinch it, you might be dehydrated. Another thing to look at is color. So look for even skin tone without discoloration. Skin color can indicate overall health. And you'll see some pictures where when we talk about skin color, I mean, we're talking about extreme things like cyanosis, where you're blue or really irritated and it's red, that kind of skin color. Temperature. So there's a normal range of temperature for the skin, and it should be at body temperature. So you can feel for it, and then you can actually test for it with medical devices. The assessment would be to, like, say, check for a fever, hot skin all over, or maybe just in a localized area. If it's in a localized area, you might have like an injury, or for some reason blood's pooling to that area. If you have it all over, you might just have an infection. They check for, the next thing is moisture. So we want to find a balance of moisture. So skin shouldn't be too dry or shouldn't be too moist. So if you're either one of the extremes, that can indicate some underlying issues. So if you have too, I'll say moist or oily skin, moisture, I was reading that some of those things can be due to diet. And I find that really interesting. So, the next thing would be texture. So this is a feel. So healthy skin is smooth. It's not rough or thick. So the dermatologist will look for consistent texture without patches. And the next thing, the last thing they're going to look for is lesions. So any abnormality of the skin, like scars, moles, or surgical incisions. Now the image I have up there doesn't really do a lot for the terms we have, but yeah, it's good to give you some more information on what healthy skin, what to look for. Let's go ahead and jump into some common skin ailments. And the first one is acne. This is a common skin condition. It's often associated with adolescence due to increased sebum production. There's something called comedones. We have closed comedones and open comedones. So closed comedones are like whiteheads. These are pores, they're clogged with sebum and with dead skin cells. The black heads are open comedones. These are pores that are clogged with sebum and dead skin cells, and they're exposed to air, and it causes them to turn black. So that's what, when you see those pictures with the people doing those pore strips, and you see they put the pore strips, they got a bunch of little black dots. Those would be open comedones or blackheads. The next condition that's common is alopecia. This is abnormal hair loss, which can occur anywhere on the body. Examples could be, you can have total hair loss, alopecia universalis. That just means you just lose hair, like your eyebrows, your mustache, beard, not just the hair on top of your head, hair everywhere. Or you can have just what's common, male pattern baldness, which is common again amongst males. The next word is diaphoresis, and this is excessive sweating, and this is a medical condition. So this is a symptom where, let's say you're not exercising, and it's due to something else, and you're just excessively sweating because of something else. Rosacea is a redness of the skin on the face, often affecting the cheeks, the nose, the chin. It's a chronic condition, and it can cause significant facial redness. The last one is hirsutism, and this is excessive hair growth in women, specifically to women, because women don't normally grow facial hair. So to be excessive hair growth in women, often dark, coarse hair in the upper lip, and sometimes in the upper arms. Right? And the cause, it's often related to hormonal changes, and that can be seen in older women. The next topic is skin discolorations. Let's go ahead and jump right into these. The first one is cyanosis, and this is an abnormal condition of being blue. And I have images there so you can use as reference. There is a subcategory of cyanosis, acrocyanosis, and that'll be we have a blue discoloration of just the extremities, the arms and the legs. It's common in healthy full-term babies for like the first 12 to 24 hours after birth. The next term is ecchymosis. This is a medical term for a bruise. So you say telling a family you have ecchymosis might get you some sympathy if you don't want to tell them you got a bruise because you got a scruffle. Scruffle is probably not the right word. Erythema. This is redness of the skin, and it's often due to an infection or some inflammation. Jaundice we've talked about before, right? It's a yellow discoloration of the skin. It's a combining form from the French word jaune, and I can't say that Frenchy enough, jaune. And the other word for yellow would be xantho, which both mean yellow. The next term is pallor. It's a muted, less colorful skin tone. So think of pale. I was going to say pale face, and I was going to say vampire. You know, the vampire look. It doesn't necessarily have to be very pale, but it's a loss of coloration. If you see somebody who just looks extremely lighter colored, and it's not due to some makeup, right? The next one is petechia or petechiae, and this is a very small pinpoint hemorrhages that are right under the skin. They look like tiny little red dots or little bulges of busted blood cells. So you can have a single petechia, and it's easy to miss because it's real tiny. You can have petechiae, which is plural, and they're more noticeable because you'll see a cluster of them like you do there in the image. And that can be related to bleeding or disorders or some kind of trauma. Okay, so here I just put the picture, an animated picture and an actual photo showing you the difference between petechiae, ecchymosis, and another condition called purpura. You see how they look very, very similar, so you definitely need to see a dermatologist to distinguish the difference. Now, if you have ecchymosis and you got a bruise and you know where it came from, I'm pretty sure you'll be fine. Okay, let's continue with skin injuries here. We got quite a few: abrasion, blister, burns, callus, cicatrix, decubitus, excoriation, and laceration. So let's start off with the first one, abrasion. And I've got some images there on the side. They're not all related to the terms, but I just put a various pictures of different injuries. So abrasion, this is a brush burn where the epithelial cells, they've been rubbed off, but the skin is still intact. Right? A blister, yeah, I know you've had these before, so you can kind of maybe relate to what you've gotten in the past. It's due to friction. It causes the epithelial tissue to detach from the dermal layer. And then what happens is it starts accumulating fluid, and that's where you get that blister, fluid-filled blister. The medical term is the medical term, bulla, or plural bullae, just kind of means blister, I guess. The next one condition is burns, and this is just caused by excessive heat that's applied to the skin, and it starts breaking the skin down. We have categories of burns: first, second, third degree burns that affect the body surface. Either it affects certain layers of the skin, or it goes all the way through the skin, which is the third layer of the skin. And the conditions are by which layer they affect. Right. First layer of skin, first degree burn. Second layer of the skin, second degree burn. Third degree layer, where you go down to that base layer, third degree burn. Callus, this is a hardened area of skin due to the mechanical repetitive forces. It's often referred to as a corn. Right? So if you work with your hands and you work outside, either in construction or agriculture, farming, whatever, if you use tools a lot, you develop calluses. Because of the constant rubbing and rebuilding of that tissue. Cicatrix, I think it's the way it's pronounced. It's a medical term for a scar. Right? The next one is the decubitus ulcer. It's also known as a decube. These are pressure ulcers caused by prolonged immobility where you have pressure on certain areas, and it leads to decreased blood flow, and the skin ends up breaking down. So these are for people who are immobile. They're in bed and they can't move on their own. Someone has to come in and move them frequently so that the blood won't pool to that particular area and the skin won't break down. The next one is excoriation. It's a scratch where the skin is intact. And the last term is laceration. So this is a penetrating wound or cut where the skin has been broken. All right, let's go ahead and jump into skin infections. The first one, and I'm going to just read the whole list first, which is abscess, cellulitis, tinea, verruca, pediculosis, and scabies. So abscess, this is a break in the skin, and it allows bacteria to enter and create an area of infection. So microorganisms are very opportunistic, and so they're just waiting for an area of the skin to break down to get into there. Cellulitis, this is an infection affecting the connective tissue of the skin and muscle. It's often seen in like IV drug abusers due to unclean needles. Tinea, this is a fungal infection of the epidermal layer of the skin, and you see there we have several examples of tinea. So it can be athlete's foot, jock itch, ringworm, and tinea pedis, tinea unguium, excuse me, tinea cruris, and tinea corporis. I said athlete's foot, yeah. Verruca, the medical term for a wart, and it's caused by the human papillomavirus, HPV. So this can appear as common warts on hands or genital warts from sexually transmitted HPV. The next one is pediculosis, and this is an infestation of lice, and it's typically on the hair of the head. The term pediculo just means lice, and it's not related to the feet in this case. So an example, a head lice infestation. And scabies, a little different from lice. It's an infestation of a tiny parasitic mite, and it burrows underneath the skin, and it causes extreme itchiness. So a symptom of scabies would be the combining form we mentioned at the beginning of this lecture, pruritus, pruritus, yeah. And again, that's just intense itching, and that often leads to like scratching, intense scratching, where you break the skin and you have exposure now on the skin for other opportunistic organisms. All right, let's get into skin markings. So the first two we're going to discuss, and you have images here for nevus and keratosis. Nevus is a benign skin lesion. It's present from birth. So that picture you see there, that's on a newborn. So sometimes it'll look like a birthmark or a mole, and it can be tiny, and some can be, very noticeable. The plural for nevus is nevi. The next term is keratosis. This is an abnormal condition related to just an overproduction of keratin. So you'll see like a spot somewhere on your skin, a brown spot. A good example, or where you can get these, is called, there's a condition called solar keratosis, and we know that's caused by decades of sun exposure, and that just sort of leads to a thick, crusty skin, and it tends to be more dense with melanin, so it'll have that discoloration. You can try to exfoliate, you can try a bunch of stuff, but it won't go away. Right. Okay. All right, here I just show you a picture of the progression of solar keratosis. Right. I'll leave the slide on for just like 2 seconds. All right, the next skin markings, we're going to talk about hemangioma. So we talked about nevus, keratosis, this is hemangioma. So hemangioma is just, so if we break down the term, right? Oma means tumor, angio means blood vessel, and hema means blood. You put all of that together, it's a benign tumor of blood vessels, and it's often seen as a red or purplish birthmark. It's commonly known as stork bites, and so it typically appears on the face or the back of the neck, but it can occur anywhere on the body. So this is, again, the picture shows you a little child, but you'll see this on newborns. The prognosis is that it's benign. It usually fades by the time the child reaches kindergarten. An example would be you have a little newborn, adorable baby born with hemangioma. on the right side of the face in their temple area, but it tends to like fade or go away. I didn't want to put the picture of the baby, so I put the cartoonish image. I didn't want to put the photo of the babies. All right, skin markings continued. Papilloma, these are very common. Skin tags is what you call them, right? It's an outcropping of skin from the epidermis and the dermis. So it's this real small, benign growth that just varies in appearance. The next one is senile lentigo, and this is age-related skin markings. It's often referred to as liver spots. I think I have a picture of this on the next slide. Yeah, I do have a picture of this in the next slide. Let me see, go to the next slide. Yeah, there we go. Yeah. So this is senile lentiginous. So you see there age spots on the face and on the back of that individual. Okay. And I did put the picture of the hemangioma. So here's a child with hemangioma on the left side of the face and the temporal area. And again, it's set to go away by the time they are in kindergarten. So what age do kids go to kindergarten? About 5? 4 or 5 years old? Okay, let's go ahead and jump into skin neoplasms. Right, so we're going to talk about basal cell carcinoma, squamous cell carcinoma, and the malignant melanoma. I think I have images for each one of these in the next slide. So what is a neoplasm? Neoplasm just means a new growth, usually implying malignancy. We have these types of carcinomas that we mentioned here, the basal, squamous, and malignant. So the basal, talk about what it looks like. It varies, right? It appears as like a pearly or waxy bump, and it's often found like on the face. The danger level, if you think you have basal cell carcinoma, well, it's the least dangerous one. It grows very slowly. It rarely spreads to other organs. One thing about skin cancers, and this was like a statistic that I read a few years ago, and I'm assuming it stayed the same, that skin cancers, if they're detected early, all skin cancers are 100% curable. It's only when you don't detect them and they spread that they become a problem. So I wouldn't assume that we've gone backwards on those statistics. Yeah, and basal cell carcinoma just happens to be the most common type as far as prevalence. The squamous cell carcinoma, this appears like a red scaly patch. Sometimes an open sore or like a wart-like growth. This can spread, so this can metastasize, and it does so, but it does it really slow. It's not usually fatal. And the prevalence of squamous cell carcinoma, it tends to be common in areas exposed to the sun. So your arms, your legs, if you wear short sleeve shirts and shorts and so forth. Malignant melanoma. This can vary, but it's often like a dark and irregular shape. This is the ones you probably might remember that stress most often, right? As far as danger level of a malignant melanoma, this is the most dangerous. It might be why it's stressed the most often. It can spread to other organs easily. It has a prognosis of like a 5-year survival rate because it does metastasize. So this is one of those things, again, if it's caught early, you'd be fine. You don't want to wait. The prevalence of this, it's less common, but it happens to be very serious. So the one that happens, the one that happens the least likely, it is the most serious. There's a ABCD assessment for melanoma, and then you can see there on the image, A is for looking for something that's asymmetrical, B is looking for those borders, C is looking for the color, and then D is looking for the diameter. So does it grow? Is it a different color? Is the borders irregular? Is it asymmetrical? And so physicians will look at this as a way to determine whether you need a biopsy. Right? And only a biopsy can give you a definitive diagnosis for cancer. So color, making sure it's not uniform. You see that one right there, C, right? It doesn't look uniform. Some of it's lighter, some of it's darker. So the border, the edges are irregular. So are they ragged? Are they notched? Are they blurred? And then the asymmetry is like, is it symmetrical, or semi-symmetrical, pseudo-symmetrical, or is it really asymmetrical? Okay, and here I just have an image of basal cell carcinoma zoomed in. Right. And here I have two images of squamous cell carcinoma. One is a 95-year-old female on the shin, and the other one's an 80-year-old male's scalp. So that happens to be an issue when you have hair loss, right? The hair on your head is also to protect your scalp. So if you have hair loss, it would be a good thing to wear sunscreen and wear a hat. All right, and then here I have different types of melanomas, malignant melanomas, and you can see a normal tumor and one that's maligned, top and bottom there. You can compare the two by asymmetry, whether they're symmetrical or not, the borders, the color, the diameter, and if it's changing, any of those are changing. All right, so I want to say fantastic job. I know this is a very long lecture, and you've made it this far. We're going to go ahead. That was health and wellness. We're going to move on to procedures. So one thing you just want to get out of that last section is just remember to take good care of your skin. Make sure that you regularly check for any lesions. Always wear sunscreen to protect against UV damage. No one is impervious to UV damage, so everyone wear sunscreen. And again, if you've been hanging on straight through this whole lecture, which is right now I'm seeing 51 minutes, great job. Or if you've been pausing and coming back to it and remembering where you came back, great job as well. All right, let's go to the next section. All right, and for me it's been like half a second. For you it may have been a minute or a day. The next section for dermatology is procedures. So hi and welcome to the last part of this lecture. You've made it. With procedures, we're going to talk about common dermatological procedures like biopsy. I'll try to get into things. I'll mention some like cryotherapy, which is to treat skin lesions by freezing them with nitrogen. That actually happens. So they do this for like warts, skin tags, and precancerous lesions. Some of the stuff you might know from some of the YouTube channels that deal with dermatology, where they do all those beautification type of therapies, and maybe not so much medical therapy, but just aesthetic therapies. So laser therapy can be used for both, right? But so it's used to treat various skin conditions using that focused light beam. An example for aesthetics would be something like removing tattoos. People can use it for hair removal if they feel they got excessive hair growth. Now these are not medical conditions, you see, but they're more aesthetic. But it can still be used for medical conditions like treating vascular lesions. And so that's what laser therapy would be good for. I didn't mention biopsy. That's a dermatological procedure. You won't find that in the estheticians or cosmetology, places, but you will see that in your dermatologist. And again, just a reminder that biopsy is it's to diagnose skin conditions. So you have to remove a sample of skin for examination. And there's several that I'll show you in this slide in this next section. One is called a shave biopsy, where you're actually like shaving the pieces of skin. There's a tool that's used to punch a little hole, like a hole puncher almost. And so it's a hole punch biopsy. It's not called a hole punch, it's just a punch biopsy. And there's an excisional biopsy. And I have pictures of those on the slides. And what else? I said that, chemical peels. That's also for estheticians. Right? So people get chemical peels. They do this to improve the skin's appearance by trying to remove that top layer of dead skin cells. Sometimes it ends up pulling off more than that, and people's skin becomes very sensitive for a little while. It's also used to treat wrinkles, acne scars, hyperpigmentation by sort of removing that top layer. Again, going back to medical treatments or procedures, there's Mohs surgery. This is, again, to remove skin cancer layer by layer while preserving as much of the healthy tissue as possible. So this is when you're treating basal cell carcinoma or squamous cell carcinoma. There's a procedure called dermabrasion. And I think this can be done both at the esthetician and the dermatologist, because I think I've seen this like in videos done by both, unless there was a doctor just doing like cosmetology stuff for some reason. But it's to help improve skin texture. So what they do is they exfoliate the top layers. So the devices that they use for dermabrasion are medical devices. They are classified as medical devices by the FDA. And it might even be the same brand model that your dermatologist has as you would see at the cosmetology place. But if you're getting it done for a medical procedure, you want to get it done by the medical doctor. All right, so an example for dermabrasion would be like treating the acne scars, maybe some fine wrinkles and sun damage. There's another procedure called sclerotherapy. This is to treat those spider veins and varicose veins, and they do this by injecting a solution that causes the veins to collapse, and so then you don't see them anymore. So again, used to treat spider veins, varicose veins. This other procedure that you might have heard of. Hopefully nobody's been using it, but Botox injections. That's very, very common. I'm really surprised when I have a friend and I've known them for years and I had no idea they've been getting Botox injections, you know, all these years. You just don't know who gets them, but it's probably way more common than I know. So Botox injections are used to reduce the appearance of wrinkles. What they do is they temporarily paralyze muscles so that you don't develop those wrinkles. But then again, when it wears off, the wrinkles come back. It's normally done like to treat forehead lines, crow's feet, things like that. All right, so that's what we're going to do here in procedures. We only have a few slides for this, and so that's kind of why I gave you that whole rundown on this first introduction slide. And let's get started. We got like 4 slides. All right, so if I didn't say welcome to the very last part, well, welcome. All right, so we're going to be talking about some procedures here. These are going to be medical procedures, and the other one, what I talked about before in the previous slide, is a mix of both medical and like cosmetology stuff. So the first one is biopsy, and again, I mentioned this is like a surgical procedure to remove tissue, and that's going to be done for analysis purposes. And the purpose is that a doctor wants to diagnose the skin conditions. Right? The next one is liposuction, and this is surgically removing fat using suction. Right? So liposuction just means to suck fat. It's used for cosmetics. So in this case, it is a cosmetic procedure. I'm sorry, I did say that these are all medical treatments. But again, in my own opinion, and I'm trying not to give my own opinion on these, so my lectures stay relatively short. I think that some people could get liposuction as a medical treatment. There are people who just, you know, for whatever reason, and they had a hard life, and they end up being obese, and they have high blood pressure, and they can't exercise, but they want to. All of a sudden, they get that will to do it, and they're having to fight all that weight. So I thought, if someone in that particular situation got liposuction and lost like a good 20 pounds just through the surgery, it would make it easier for them to actually start their exercise program, right? So yeah, having liposuction will do nothing for like removing plaque from your arteries or anything, but it probably will make them feel lighter so they can actually move and walk more often or jog more often or do something like that. So I think liposuction could have some like indirect medical purpose, and it should be open to that, I think, especially since people have been fed really bad food by manufacturers. All right, again, that's strictly cosmetic. Skin grafting, this is when we replace damaged skin with healthy skin. And we talked about allograft, we talked about autograft, and I think I did, oh yeah, we also mentioned xenograft. Yeah, we did mention that. And then there's another one, it's called synthetic. So this is where you get collagen-based graft that it helps the body regenerate its own skin. There's a real cool new technology that just came out, and I'm saying like around 2019, 2020 was, no, probably 1920 is when it was still in research, and they were still doing like patient trials. It's a skin gun, and so what they do is that they get they get cells from the individual who maybe, let's say they had a second-degree burn, or yeah, let's just say a second-degree burn on their right shoulder. And normally that would take months for it to repair with little tiny skin grafts and implanting, healthy skin cells and trying to let the skin grow, naturally. But with this skin gun, they can actually spray like thousands and thousands of these little tiny spot pods, and it kind of looks like a spray gun, like you're spray painting paint, and it tends to heal within a couple of days. So I wish I had a picture of it here. I didn't think about it. You can look it up. It's a skin gun, and one of the very first people that they tried it out on, I think he was a firefighter or a police officer, and he got his whole arm burned, and his recovery was over the weekend. And so he's like on the very first documentary back in whenever they first had it, and then he's up on the commercial when they try to market the device. So it's a pretty interesting device. I don't remember the name of it. Okay, let's go into the next one. Dermoplasty. We have blepharoplasty and rhytidectomy. So excuse me. So dermatoplasty first, it's the surgical reshaping of the skin, right? So, and that's also used for cosmetic or constructive. Again, I also think that this could have medical purposes as well. It shouldn't be, cosmetic and reconstructive doesn't necessarily mean just for aesthetics, right? If you get if you have heart surgery and you don't want a giant scar down the middle of your chest, some of the procedures that are learned by plastic surgeons could be utilized for those type of surgeons, so that you have a less scarring, less site for infection, all that kind of stuff. So I kind of think that some of these things could be used for medical purposes indirectly. You can validate it indirectly. But the first one here is blepharoplasty. So it's the surgical reshaping of the eyelids. So they'll do this to improve, for some people, to improve vision when you have what's called a hooded eyelid. Rhytidectomy, this is removing wrinkles. We mentioned this one before when we talked about the combining form. So removing wrinkles that are commonly referred to as a facelift, right? Facelift, rhytidectomy. And again, these purposes are cosmetic, just used to reduce the signs of aging. And that's, okay, is that it? No, that can't be it. Is that the end of my chapter? No. Whew. Okay. Diagnostic procedures. I just got one more slide. So again, we said, no, that was it. Biopsy, culture. Oh, I just have a picture of the, I'm sorry. I just have a picture of the culture and sensitivity. So diagnostic procedures, again, biopsy is another, it's also a diagnostic procedure. Culture and sensitivity is just, oh, I'm moving my mouse around. I don't think you can see the mouse. So you take skin samples and you culture them and you look for, and microbiologists will actually do what are called biological assays to test what type of infections are there. Allergy skin test. I thought I had a picture for an allergy skin test. I did in one of the previous slides. And that's the one where they'll like mark your skin with a bunch of little spots, and each little spot gets its own little allergen, and then they see what you're allergic to, right? So they kind of hit you with everything. RAS and Wood's lamp. RAS is called a radioallergosorbin test, and this is a blood test to measure immunoglobulins produced in response to those allergens, right? And Wood's lamp, this is it's a diagnostic tool that uses ultraviolet light to detect fungal infections and some other skin conditions, like if you're diagnosing tinea, which is ringworm, and vitiligo, which is it's a certain fungi and conditions that are just visible under UV lamps. All right, and that is the last slide. Yes, that is the last slide. Thank you very much for making it all the way through the dermatology section. This whole lecture took me more than an hour. I didn't realize it would take me that long. But after this, you have some homework assignments and some exercises to do. And again, thank you for hanging on this long. And I'll see you in the next season.